Well, good morning. My name's Kylie Brown, and I'm the Associate Lecturer for Rural Placement Education for Going Rural Health at the University of Melbourne Department of Rural Health. I'd firstly like to invite you with the acknowledgement to country. I would like to acknowledge the traditional owners on the land which this webinar is recorded and streamed. From where I'm hosting today in the Shepparton region, I acknowledge the elders and descendants of the Yorta Yorta Nation people who have been and are the custodians of these lands. We acknowledge that the land on which we meet was the place of age-old ceremonies of celebration, initiation and renewal, and that the local Aboriginal peoples have had and continue to have a unique role in the life of these lands. We acknowledge the elders past, present and emerging, whose cultures and customs nurtured continue to nurture these lands. I'd also like to continue with some housekeeping. Could I please ask viewers to change your view on the top right-hand corner to speaker view? You may need to increase your video or your audio on your computer to allow you to hear the videos that will be shared today. There'll also be opportunity to ask questions throughout the Q&A icon on the bottom of your screen. These will be answered at the end during our panel Q&A discussion. Please note that we may not be able to answer all questions due to time constraints. Going Rural Health is so excited to present a webinar showcasing some of the innovative placements that we've supported during 2020. Going Rural Health is an initiative funded by the Commonwealth Government Department of Health in Canberra through the Rural Health Multidisciplinary Training Program. They exist to support students enrolled in a nationally recognised nursing, allied health or other health science undergraduate or postgraduate degree at any Australian university. Going Rural Health can provide support for eligible students, education and supervisory and mentoring support, placement matching and creating and cultural training. We also provide subsidised accommodation, money for travel costs, mental health support and local area knowledge and orientation. Firstly, this morning, I'd like to introduce three of my colleagues from the Going Rural Health team, Claire Salter-Parry, Rebecca Oates and Charmaine Swanson. They'll be presenting on their journal article that they've recently published.
Thank you, Kylie. Good morning, everybody. This is a wonderful opportunity for my colleagues Rebecca, Claire and myself to share with you an overview of our journal article. Today, we will explain the reason we developed the paper, the key findings covered in our literature review, the strengths and challenges we encountered, and recommendations for student placements going forward. In May of 2020, the International Journal of Work Integrated Learning sent out a call for papers on how work integrated learning student placements were being adapted to meet placement needs in the midst of the disruptions caused by COVID-19. Myself, Claire and Beck develop and support service learning student placements for the Going Rural Health team. With service learning being a form of work integrated learning, we took up the opportunity to write up how our placements were adapted and what we learned through the process, and submitted the paper, which was published in a special COVID edition of the International Journal of Work Integrated Learning in September this year. The placements we focused on in the article included a physiotherapy student placement in a specialist school, an occupational therapy student placement at a community organisation where students worked in mental health, a speech pathology placement where students were on placement at a primary school, and an occupational therapy student placement where these students worked on an intergenerational kinder and aged care program. I will now hand over to my colleague Claire, who will discuss our literature review.
I get to talk about the most interesting part. So we looked at three key areas of the literature to inform our adaptations to placements. We looked at service learning, tele-supervision, and collaborative models of supervision and learning. So service learning placements are equally concerned with student learning and work readiness, as well as achieving outcomes for host organisations and their clients. Key characteristics identified for successful service learning partnerships and outcomes include responsiveness, trust, innovation, community leadership, consistency, flexibility, reciprocity, and knowledge sharing. Telesupervision offers a viable solution to geographical challenges by allowing student placements at locations that can't provide the necessary support through on-site supervision, if planned appropriately. Studies report enhanced student learning experiences with clinical educators by providing opportunities to reflect on performance, debrief while still in the clinical setting, discuss novel or challenging situations when they arose, and enhancing a sense of connection and belonging. Key considerations in using telesupervision effectively include investing in and distributing high quality equipment, collaboration with shared goals, implementing appropriate security and confidentiality measures, embedding scheduled telesupervision sessions, and ethical considerations such as informed consent. In essence, collaborative learning acknowledges that the students capitalise on one another's knowledge and skills, as well as monitoring and evaluating each other's work. Group supervision, where one supervisor oversees the clinical education of multiple students at once, has been found to be as effective in supporting students' clinical growth as individual supervision. Group supervision also addresses service gaps and is more supportive of adult learning principles. These two models are most reflective of the collaborative supervision models promoted and supported by Going Rural Health. The collaborative model of fieldwork education shares the support of students across the multidisciplinary team, although has the clinical educator responsible for key assessment and learning outcomes of the students. For example, a senior physiotherapist might be the main clinical educator, but the students also spend time with the early career physio, the OT, and the speech path during their placement. The role of the capacity development facilitator supports both clinical educators and students by providing both groups with training and education, as well as liaising with the organisation, identifying opportunities and conducting evaluations. And this is very similar to the role that the three of us play before and during placements. Successful collaborative models require advanced preparation involving all stakeholders, including training in the theoretical model, planning meetings, timetabling, and clear communication. Going Rural Health drew on the concepts of service learning, telesupervision, and collaborative learning to adapt placements during the COVID-19 pandemic, which we'll detail a bit more in other presentations during this showcase. All supervisors were provided with training in the placement and were supported by the placement coordinators for the duration of the placement. And all placements integrated service improvement initiatives and were not purely clinically focused. I'll now hand over to Beck.
Thanks, Claire. So today I'll talk about some of the challenges and strengths we encountered within the adoption of our placement models to an online format in response to COVID-19. For further details, please refer to our paper in the International Journal of Workplace Integrated Learning. Some of the challenges were that students were unable to immerse themselves in the community in which they were doing their placements in. Placement objectives and service delivery was limited by scope of practice within the online format. The workloads of host staff increased as students relied on them for communication, resources, and information sharing. This was observed to impact students' productivity and autonomy in the completion of tasks. Remembering that this was a time when whole households were working from home, procedures and contingencies were addressed as a priority to ensure the privacy and confidentiality was maintained to reflect the format of the allied health students working off-site. These included the navigation of the medico-legal responsibilities and respective organisational policies and procedures. As the adoption of tele-supervision was reactive due to the pandemic, we had to source processes and tools with urgency. This proved to be quite an exploratory task, as these were limited practical guidelines and experiences available at the time. Additional time was required by the students to manage client relationships and to develop sufficient rapport to engage therapeutically. The online format limited the opportunity for supervisors to model practice, also impacting the students' ability to gain hands-on experience and observe different clinical experiences that an on-site placement would have provided them. Due to the competing demands such as homeschool commitments, clients and their carers were not always available for and did not optimally engage in the telehealth supervisions. Strengths. Now that we've discussed the challenges, we'll move on to the strengths of the online placement format. These placements continued instead of being cancelled should we not have adapted to this innovation. Students successfully met their curriculum needs and service delivery was provided, therefore addressing the identified service gaps. The collective willingness of the stakeholders were invaluable. These relationships consisted of trust, accountability, effective communication, and last but not least, a shared goal. This fostered a positive learning environment where no one was the expert. The allied health students were incredibly grateful for the placement opportunities given to them when so many placements were being cancelled at the time. In return, the students readily adapted to the ever-changing environment and had exposure to telehealth practices models that they will take into their future careers. As travel was not required in an online format, supervisors were able to offer shorter and more frequent supervision sessions. It also enabled supervisors from other geographical areas and or supervisors that had their own homeschooling or work commitments to provide supervision in this model. Planning and troubleshooting was addressed in pre-placement planning to mitigate the anticipated IT challenges that are universal to telepractice. Placements had a genuine focus on the health and well-being. This was observed to build empathy and compassion for all throughout the placement journey. In terms of key factors for adapting placement, for us, another feature of our placement was the inclusion of the key factors that we felt were critical in the adaptation of the innovative placements. This was so important to us as we hope that our experiences will assist others to adapt such a model in and beyond COVID. So for this was, some of these factors were that we established an existing relationship with the host sites, which had previously demonstrated going rural health's accountability and commitment to innovative placement models that delivered reciprocal benefits to both host organisations and students. The resourcing of additional time in the pre-placement stages to establish clear roles and responsibilities amongst all stakeholders. It was very important that each team member was clear about the responsibilities that sat within their role so that they could then effectively communicate these to the students that were being supported. And the willingness of universities to support our adaptation and think innovatively as to how any potential learning gaps were going to be addressed. I'll now hand over to my colleague Charmaine, who will discuss the recommendations outlined in our paper.
Thank you, Beck. So on reflection, through the writing of this paper, we would like to recommend that as we continue to develop valuable rural nursing and adult health placements, we hold on to the learnings of 2020. We discovered that in certain circumstances, a mixed placement model is of value, especially where placement cannot be completed full-time on site. So in this case, it could be considered for a student to do part of their placement face-to-face and part of their placement online. We recommend that we continue to include telehealth in placements, as students then are able to develop this valuable skill in the delivery of rural health services. We are now more assured than ever to encourage host sites to employ the service learning model, as especially in 2020, we have realized that it is a highly adaptable model and responsive to community and student needs. We recommend working with student support programs such as Going Rural Health, who can support host sites to implement varied online contingencies when circumstances require it. And lastly, we have realized that on occasion, delaying the start of a placement as opposed to cancelling the placement is often all that is needed when a host site faces challenges, and often at short notice, that it is possible to delay a start of a placement by a week or two in order to put in good contingency plans. So if we have a look at the next slide, if you would like to know more about our article, please go to the International Journal of Work Integrated Learning's website, and there are all the details about the article. And we thank you very much for allowing us to share our 2020 journey with you.
Thanks so much, Claire, Beck, and Charmaine. That was awesome. Okay, so now I'd like to introduce a video presentation from Brooke Ferguson and Carol Reid, who are based at NCN Health in Numurkah and have been involved in creating innovative placements for their students.
Hi everyone, I'm Brooke, the Allied Health Educator at NCN Health Numurkah. On behalf of our education team at NCN, we want to thank you for inviting us to come and speak to all of you today about the exciting opportunities our educators offer allied health students. At NCN Numurkah, we have a great education team that works together to provide fantastic student placements with many great learning opportunities. Carol Reid, who you will meet soon, is our research coordinator who works with all students who take part in a project placement at NCN Health. We've also got Jenny Burrows, who is our health promotion officer, who also plays a large role in supervising and organising students undertaking project placements. At NCN Health, we also offer many clinical placements with our occupational therapists, social workers, physiotherapists, dietitians, allied health assistants, and of course, our nursing as well. So today, Carol and I will talk about some of the project placements we have previously run with our students. And we're also going to discuss how we worked around the challenges of COVID and continuing to provide students with great educational opportunities whilst on placement here at NCN Health. So I'll hand you over to Carol.
Thanks, Brooke. So hello everyone, I'm Carol Reid. I'm with Rural Health Academic Network with the University of Melbourne, and I'm co-located at Numurkah as Research Coordinator, as Brooke said. So my role at Numurkah is to increase research and evaluation capacity. And I'm very fortunate to be involved with the education team and able to be involved with exciting student placement projects. So the student projects are a great innovative way to learn project management skills, to engage in research, get a deeper understanding of linking client needs to practice, and of course, translation of evidence to practice in meaningful ways. So our next slide shows some of the community engagement we've done with students. We really encourage connecting with our rural community. So we've had students go out on Start a Heart Day, they've visited kindergartens and schools, they've been to different learning centres, and they've canvassed different businesses around the small townships in Moira Shire. So I'll just hand back to Brooke, who's going to talk a bit more about virtual placements at Numurkah.
Thank you, Carol. So as Carol mentioned, we encourage our students to get to know some of the community members, programs, and also organisations and also gain an understanding of the wider community and some of the challenges that we face living and working rurally. So this has been a particularly challenging time over the past 9 months of COVID, as most of you would agree. So we have therefore offered 2 virtual placements this year. So one was with 2 dietetic students and the other was with 4 social work students, and that one has just finished recently. And they were both project placements via a virtual platform. So since students could not physically attend our health service, we had to adapt to ensure that we met students' learning goals and needs of our health service and local community. So the most important aspects of the placement to make sure that we met their learning goals was, one, that students had an understanding of our rural community, its challenges and its needs. And this was very important, especially for our students from the metropolitan areas, as they were required to develop some groups and some resources for our local rural community here in Numurkah. And this was certainly challenging, obviously being a virtual placement trying to do this. So 2, that students felt part of the wider multidisciplinary team here at NCN Health Numurkah, and that they were connected to supervisors and the project team. And 3, that students had access to information and external stakeholders where it was appropriate. So luckily, thanks to technology, we were able to adapt our placements to meet the learning needs of our students and for them to understand how it works rurally in our community at Numurkah. So in terms of understanding our community, its needs and its challenges, students actually had the opportunity to interview some of our current clients. They participated in Going Rural Health webinars and courses, including the Cultural Competency course, which is now all run online, to make sure that students were connected to our multidisciplinary team and our educators. Students, they were able to observe weekly care coordination meetings to get an understanding of working rurally and also the different roles that our team consists of. They also met with many members of the multidisciplinary team to learn about their role. They participated in client groups that were at the time run online due to COVID. They attended weekly debrief meetings and also weekly project meetings with supervisors and educators. And they were also able to meet with other students completing placement at NCN Numurkah via a virtual platform again. So to ensure that students had enough resources and also had access to external stakeholders as well in our community, we used Microsoft Teams so that both students and supervisors could access or review information at all times. They also were able to meet with some external stakeholders relevant to their project, of course, and also who were familiar with our community at Numurkah. And some of those stakeholders were the school nurse, the community development worker, Headspace, Goulburn Valley Centre Against Sexual Assault, Flying Headspace as well. The other thing that students did is that they looked into other community projects and initiatives so that they can see the community context and other ways that we can work with the community, which obviously working in a rural community that can be quite different. So they can see where their project sits within the broader context as well. So that's it from Carol and I today. Thank you for listening to our presentation. We look forward to working with you all to develop and provide some creative student placements in 2021 and into the future. So thank you very much.
So thank you to Brooke and Carol. I'd like to now introduce you to a presentation from Lauren Woodhart, who is a physiotherapy supervisor at Ballarat Going Rural Health.
Hello and welcome to this presentation on online physiotherapy placements. Firstly, some background. Throughout 2019, Going Rural Health supported Beaufort and Skipton Health Services with on-site student placements. On-site placements were planned for 2020 but were cancelled due to COVID-19. Planning then commenced to take these placements online, and online placements commenced in July. In designing the online placements, there were some challenges to overcome. Physio is known as a hands-on profession, so we had to work out how can an online placement maximise learning opportunities, meet the needs of students, the university and the host organisation. Timetable coordination was more time-consuming due to pandemic-related uncertainties. And when awaiting communication responses and scheduling meetings, it was important to be mindful of the additional pressures staff were already experiencing due to the pandemic. Placement planning had 4 main areas. First was to clarify the host organisation's needs. The main need was for physical wellbeing resources that staff could access, targeted to their needs as staff were presenting for physio treatment and were experiencing increased stress and strain due to the pandemic. Next was working out the students' roles, the additional supports and learning experiences, and coordinating a timetable of activities. Placement content included orientation meetings and meetings with key health service staff, online supervision sessions, which included tutorials, clinical discussions, reflective practice, planning and feedback, blocks of project work, observation of physios who are working on site with clients, telehealth consults, mentoring and education sessions, and some interprofessional work with an on-site occupational therapy student. We also ran some simulation telehealth sessions with Agnes from Shepparton. Agnes had a fall at home during lockdown and the students were able to provide assessment and treatment. Thanks to Mitch Dunn for providing this experience.
Hello, dears. Agnes here, darlings.
The timetable was a live Google Doc. Project work was also stored and shared using Google Drive. We used lots of email communication and, of course, Zoom. Students produced several fact sheets along with 8 short videos for staff. Students also pre-recorded 5 gentle exercise classes which run for 20 minutes each, and staff can complete these independently or in small groups to improve their physical well-being. To show you the quality of videos produced, here is an example from the low back pain video.
Low back pain is often associated with improper coordination of the muscles that support the spine. As muscle tone and motor patterns improve, spinal stability also improves, which leads to decreased pain. The transverse abdominis is one of these key muscles. It acts as a corset and is typically activated prior to moving your arms or legs to provide stability in the spine. There are some simple exercises you can do to train your transverse abdominis. This encourages optimal activation during your daily activities. Lie on your back with your knees bent and tuck your tailbone so that the spine is flat to the floor. You may choose to place your fingers 2 centimeters inward from the bony prominence of the front of your pelvis to help you feel the muscle fibers contract.
This video goes on to demonstrate core exercises. What went well? Paired placements enabled enhanced learning with students learning from each other and also supporting each other. Students were committed, tech-savvy, knowledgeable and adaptable. Going Rural Health provided an iPad for both Beaufort and Skipton campuses, which enabled students to connect with patients and the different settings. There was a good variety of learning experiences. Student learning needs were met and placements were passed, and high-quality needs-based resources were provided to the health service. Here are some of the learnings. Online placements took time to design but were valuable and engaging with positive feedback from students. It was an advantage to have established relationships with key contacts. Ensure the uni subject block aligns well with available placement activities and that the roles and expectations are outlined clearly. Additional mentoring and education support adds depth to the learning experience, and as a supervisor, support from the placement coordinator is valued throughout the process, and I would like to thank Charmaine and the Ballarat Going Rural Health team for their assistance. Thank you.
Thanks so much, Lauren. That was awesome. I'd now like to hand over to Johanna Kiriakou, who's our University Department of Rural Health Promotions Coordinator, and she's going to present on some recent students' experiences. So thanks, Johanna.
Thanks so much, Kylie. So what I'm about to show you now is called Real Talk, and Real Talk is a video series that we created this year. Being unique and innovative, we had to think outside the box for promotions and really utilise Zoom and the capabilities that could provide. So what Real Talk is a series where past and present Going Rural Health students speak to future students about their rural placement experience. Our students discuss various things from their highlights to their challenges to really educate the future cohort of nursing and allied health students considering a rural placement and give them absolutely the brutal honesty of their placement experience. So we have viewed and promoted this all via social media, which again has been a major engagement platform for students this year. And I'm sure it will be and has been in past years as well. So we've condensed all these episodes into a 5-minute short for you today. So sit back and enjoy and hear from some of the amazing students going Rural Health in 2020.
My name is Taylor and I'm studying at the Fitzroy campus of ACU.
So my name's Mitchell Matheson. I'm a 4th year occupational therapy student.
My name's Edwina Vajorana. I'm doing a master in clinical psychology at Victoria University.
My name's Annie. I am studying physiotherapy at the University of Melbourne.
I'm Kirsten. I'm from the University of Melbourne and I'm studying physiotherapy currently in my 2nd year.
I'm Erin. I'm also studying at the University of Melbourne and I'm also in my 2nd year of my Doctor of Physiotherapy.
I'm Melanie and I'm from Monash University and I'm doing Bachelor of Occupational Therapy.
My name's Chelsea. I'm studying occupational therapy, 3rd year, and I'm from ACU.
My name's Ruby. I'm studying occupational therapy in 3rd year and I'm based at ACU.
The main differences that you find between like metropolitan placements and rural placements, it's the physio group at Rural Health is obviously just a lot smaller. There's only a group of, I think, 4 physios in the entire hospital. So you being that extra person is just, you make up a pretty significant amount of that team. So that's really cool. And you do feel like you are making a difference and taking on some of their wait list patients. So I felt like I was making more of a difference in the rural placement compared to my metropolitan placement.
I sort of found that I have had placements both in the metro setting and the rural setting. And I found that there is a slight sort of difference in the culture in some of the workplaces that I've been at. I sort of enjoy the slightly more relaxed, sort of friendly nature that the community, like more rural setting gives you. I think you sort of develop sort of some deeper relationships with people. And just from my experiences anyway, I think, yeah, you build those interpersonal relationships really well, just because it's not as a fast-paced environment.
In a rural placement, and especially in Euroa, that being the only clinic in that sort of area, you kind of you couldn't just work with, things that you've already worked with, such as depression, anxiety. You see a range of different sort of psychological illnesses.
Having community and just a lot of variety of patients. I think that's something that I didn't really get a lot of experience and a lot of, face-to-face contact with.
I would say one of the biggest things is that a lot of people wear multiple hats.
Yeah, there was just so much support. I think that really was a highlight of it. I don't think we could have got through that 5 weeks without that support from Rural Health and from Dominique and all those people that came together.
Something that I really loved was the variety of patients I actually got to work with on this placement. It was a huge age range, a huge variety of presentations, and so yeah, I was exposed to a lot, which I loved.
This experience overall has been an amazing experience. Like, I've learned so much and I can't wait to start working and then hopefully maybe even get to experience this on my own and have a job in this area.
Near the end of the placement, when I was kind of handing off my patients and letting them know that their next appointment wouldn't be with me, and one of the patients, she was like an older lady and she was very petite and small, and she just held my hands and looked into my eyes and said that she just had such a good time with me and I've helped her so much and I'm gonna have a great future, and all just these really kind words that I probably didn't deserve, but she was just so kind. And I think that's just a trend in small towns.
Do it. You just put it in your application, say, yep, I want to go, because you're going to learn such different skills. You're going to see different people.
If you do get the opportunity to have a rural placement, you're going to be building a skill set that will actually set you apart from a lot of other applicants when you're applying for jobs.
Honestly, you got to do it. Like, it's really, really rewarding.
I think keep an open mind about it. Academically, it was really a very fulfilling experience, and I think it's definitely going to open my eyes to not only how I liaise with rural practitioners in the future, but also just my general practice.
I think even though it can be like nerve-wracking, especially if you're having to actually go out there, and it might feel like you're far away from home, it's just such a great experience because you get to see, like, kind of get that generalist approach. We got to like learn a lot about how you get to wear all the hats at once versus like other placements, you might be only looking at like fractures for the entire placement.
Give it a go. It's an amazing experience. The people are amazing. People from rural communities, I love them so much. I love helping them. I love how open they are. And
I would just say, just do as much as you can and come and learn. Like, I think learning and actually experiencing and going through these things is such a big learning curve for everyone, and you'll get a lot out of it.
Definitely don't knock it till you try it.
Thanks, Johanna. Isn't it awesome to hear from our students and what they think of rural placements? Just love that. I'd now like to introduce to you Claire. Would like to welcome her back, and her colleague Surabi Budaraji, who work together at Marupna Park Primary School. Surabi works as a speech pathologist, and Claire also works as a community placement coordinator for the Going Rural Health team. So thanks, Claire and Surabi.
So you've already met me. So as Kylie said, I am a community placement coordinator with Going Rural Health. And I'm presenting with Surabi, who's the speech pathologist at the school and who supervises the students. So the speech pathology program at Marupna Park Primary School started in 2019 as a partnership between the school and the Going Rural Health team. And it includes the employment of a full-time speech pathologist, and the provision of speech pathology services uses the response to intervention model. So ongoing, as well as ongoing supervision of speech pathology students throughout the year. And at the beginning of 2019, the Greater Shepparton Foundation became a partner as well. So generally, we have 2 students per placement who come for 7 to 8 weeks in each school term, and they're embedded within the school 4 days a week, and their work typically involves face-to-face interactions with students and teachers. The students complete in-class activities, one-to-one assessment and intervention, and small group sessions as well. And at times, they might also conduct training with teachers and do planning sessions with them, as well as developing resources.
So the COVID restrictions brought particular challenges during term 2 and term 3 this year. And in term 2, schools were completely closed. And although they were open to vulnerable students, and being quite a disadvantaged school, we were expecting a large number of students to come to the school, but this didn't occur. And in term 3, schools closed again from week 3 of term 3, and we didn't have many students coming in again. So in term 2, we had 1 student on placement from Melbourne. And for the first 4 weeks, she did a placement from home. And then we transitioned with the easing of restrictions to her being face-to-face at the school for her final 3 weeks. Now, during the online component, she attended meetings with teachers and myself via WebEx and Zoom. And the student was designated 2 to 3 videos to make for online learning. And these would be around vocabulary, around a reading passage for the week, spelling lessons, writing lessons, for example, how to construct a narrative. And a lot of professional learning was made freely available online for the student to complete in her own time as well. Now, term 3 was very similar to term 2, but this time we had 2 regionally based students, and they did their first 2 weeks from face-to-face, but then schools closed again, and then they spent the next 3 to 5 weeks doing their placement from home, and then we transitioned to a mix of face-to-face and online placement for the final 3 weeks. So a change was this time that the uni students we were able to run some telehealth sessions, which was really good. And these were done with students who were at the school with either a teacher or myself present with the child. And this was because we weren't having much parent engagement from the families. And this university student would log in from home to run the telehealth session. And we used the same Google Classroom link so the school kids could easily access the session without having to use any extra meeting links. Some practical adaptations that we made included the use of a shared drive, which we used for resources, sharing session plans and videos. Students were provided with de-identified assessments to help interpret and analyze assessment scores and also report on these scores, and also just to practice goal setting as well. And we had brief morning and afternoon check-in calls. Some of the factors that enabled this placement were support from the school leadership, the liaison point from Going Rural Health and the universities being really adaptable and flexible, and flexibility from the students as well. And some of the key challenges included really low attendance in the online sessions. And because we were having low engagement from parents and families, that also meant fewer opportunities for telehealth services. And the other challenge was providing enough face-to-face learning opportunities for students, and also parents feeling overwhelmed by remote learning and technological issues as well. Now, some of the key benefits that we found from these placements were that we were able to cater a placement for students with families, as the 2 students in term 3 were parents and they needed to help their own children with online learning. So it was great to have that flexibility. They learned new skills in creating online content and delivering telehealth services. We also built up a massive bank of videos that the school can now use for future learning. And we use the video lessons for reflection and also self-evaluation for students. And the videos became a form of modeling explicit teaching strategies for school staff as well, which is great. And the key elements from the placement that we want to continue to use are the possibility of having some placement days from home if needed. You continue to use a shared drive to make sharing of resources a lot easier, and recording lessons more often as well on video. And finally, to finish off, Maroopa Park Primary School won the Australian Education Awards for the Best Student Wellbeing Program, which involved the oral language program and the students being on placement. So that was some fantastic news last week as well. And thank you. And if you have any questions, please get in touch with Claire or myself.
Thanks so much, Claire and Surabi. Congratulations also on your Excellent Achievement Award. What a great thing to achieve in 2020.
Thank you.
So now I'd like to share a video presentation by University of Canberra dietitian students Lucinda Hills and Fabiola Hamadian. Lucinda and Fabiola would like to share with you their virtual learning experience at NCN Health, which is Nathalia, Cobram and Numurkah. So thank you, Johanna.
Hello, my name is Fabiola.
And I'm Lucinda.
And we are student dietitians from the University of Canberra who completed our community nutrition placement at NCN Health Numurkah. This was a 6-week placement that looked at developing recommendations for a diabetes program for the local community. We had intended on attending our placement physically, however, due to COVID-19, this placement was made virtual for us. Virtual placement meant that I could stay in the comfort of my place here in Canberra. Much like a lot of Australians this year, these are just a few photos of what my office looked like the entire 6 weeks. I was able to go to the gym in the morning, take walks during lunchtime, and make visits to even Sydney during weekends to visit my partner, all whilst completing coursework. And although I appreciated the luxury of working next to my bed, I would have loved to visit Numurkah and be physically there to observe the environment that we were working with, as my family live in Melbourne too. But the NCN staff was so flexible and still provided us with valuable learning opportunities and experiences to embrace as much as Numurkah as we could, as well as meet our competencies as student dietitians.
So in contrast to Fabiola, I was fortunate enough to be able to do my placement from a number of locations. So thankfully at the time there were no interstate travel restrictions due to COVID, so I was actually able to start my placement in Melbourne, where my family lives, and then come back to Canberra, spend a few weeks at home where I live, and then spend time back up in Brisbane where my partner lives. So this was a picture of me up in sunny Brisbane, which I was really thankful to be in because at the time it was Canberra winter and we have overnight lows that are in the negatives. So how did the virtual placement work? So it was a first for both us and also NCN. So it was really commendable that NCN could do the placement remotely so quickly. We used Microsoft Teams primarily to meet. We shared documents that way and we also collaborated. So most days we would spend communicating via email, but also video chatting and having meetings with all the team at NCN. Fabiola and I also met up regularly most days via video just to keep ourselves sane and also just to discuss what's happening in the day. While we were on our placement, we were also able to actually interview clients via video and also telephone, which is a really good experience for us. So also, while we weren't able to actually attend in-person workshops for further learning, we were provided a number of resources that included things from Going Rural Health, so we're able to do modules and also online learning on things such as cultural awareness, receiving feedback as students, and also the rural health population. So it was really great to be able to do this while we're doing a virtual placement. It was also really good to do the session online with other students in Victoria who are from other disciplines.
As with any placement, we experienced both challenges and benefits, and seeing as we were relying on technology for all of our communication, these were inevitable. So we found that working with a small rural town meant that outlets were not all online, and we could not directly contact or walk into community groups or the local gym to discuss our project and have that person-to-person organic interaction. Communication was more difficult by not being able to meet with the NCN staff in person and have conversations in passing about our project. Meetings and emails had to be set up to send any piece of information, no matter how small. And we also had our fair share of poor internet connection, figuring out audio outputs, exploring new platforms, and difficulty file sharing. But despite this, I don't think IT limited us too much, and we both felt like we were able to know the team quite well, despite being many hundreds of kilometres away. The challenges were also outweighed by many unique learning opportunities, and the most prominent one was learning how to conduct ourselves online with both staff at NCN, but also through tele and video conferencing with clients. This is really good practice and will be useful for us in future practice when conducting telehealth as dietitians. We learnt how to be technology savvy, learning how to share our screens during meetings, recording videos for presentations, and then uploading them to YouTube to make sure there are no connection dropouts instead of presenting live. We were still able to sit in meetings and meet different health professionals who work at NCN through one-on-one video meetings, and we were also fortunate enough to be provided with additional online learning modules through Going Rural Health, as Lucinda mentioned.
So to finish up, we thought we would share some of our reflections and tips. So there might be more and more of these virtual placements going forward. So we hope that if you're a student about to begin one, you can feel reassured that you'll get a lot out of the experience. So some of the tips from us looking back are to be kind to yourself, to make sure that you look after your health, both physical and mental health while you're on a virtual placement. Also the importance of teamwork. We found it really, really important to communicate really well, both with your other students, but also the staff that you'll be working with. And also to be open to opportunities. They might not seem really obvious at the start, but there are lots of opportunities which you can experience while you're on a virtual placement. So also embrace and utilize technology. There's a lot of different things out there, and you need to be quite technologically savvy to get through the experience, but you do learn lots of things along the way. And it's also really, really useful to be able to keep a daily reflection. We found that really helpful to remember what we'd done that day and also just looking back. So we hope you've enjoyed this presentation and our learning about our virtual experience at NCN, and best of luck to any future students.
So great to hear from Lucinda and Fabiola. I'd like to now introduce you to Mitch. Mitchell Dunn. He is working for the Going Rural Health team as an associate lecturer, and he's going to speak to, associate lecturer, rural placement coordinator. He's going to speak to us today on an extended rural immersion clinic that he has been implementing. So thanks, Mitch.
Thank you so much, Kylie. I will just share my presentation with everyone. So I'm fortunate enough today to be speaking about 2021. So this program, unlike some of the other projects that we've heard about today, is actually yet to occur, but I am fortunate enough to be able to be looking towards the future with this program. So what is the ERIC program? The ERIC program is an extended rural immersion clinic that we're setting up for final year and postgraduate physiotherapy students. So the program is aiming to support those students to complete a longer block placement with us in our Going Rural Health footprint, to be able to be fully immersed during a 10 to 20 week placement, depending on the university partner, within a rural community, so that they can fully experience that community as student physiotherapists. And ultimately our aim is that we will hope to affect a recruitment and retention of physiotherapists to our rural communities. So students will complete their ordinary work integrated learning placement within the normal fashion over a longer and immersive period of time with us and supported by us. And some of the perks of the program that we're hoping to implement are financial support for student accommodation, student training on rural health related topics and the rural determinants of health, ongoing student support, host site support throughout their placements for supervisors, and training and development for supervising physiotherapists that are working as part of the program. So why bother with an ERIC program? The robust evidence base for longer duration rural placements really supports this program. So some research done by the University of Newcastle has shown that 49% of students involved in a rural immersive placement had returned to rural practice. And the interesting thing was that metropolitan students were actually most likely to change their minds about a rural placement as well. So we're hoping to create a real passion and desire to return in these student physiotherapists after their opportunity to complete longer blocks in the country with us. So the main draw card of the program is that we're able to immerse learners in the local community, and student feedback from past placements has really supported this in illustrating that students are welcome and made to feel a part of the team and the community whilst they're on their placements. So we want to further enable student physiotherapists to become invested in our local communities within the Going Rural Health footprint, and to become one of the team during their longer block placements. So I myself was fortunate enough to be a part of the Going Rural Health very early on in the program. In my 4th year, I was fortunate enough to be able to complete a placement here in Shepparton. So I myself, and here I am on my last day of placement, I am proof that supporting rural placements is a driver for the decision for student physiotherapists to return to the rural community upon graduation. So the good fortune of being involved in a Going Rural Health supported placement myself, I have developed a real passion for supporting students to be able to complete their clinical placements in a rural setting. I'd just like to finish by thanking our community partner healthcare facilities that I've been working with to bring the project forward for next year. So we can see that we have several partners in our local area that are really supporting this project and getting students to be able to complete a longer block and fully immersive placement with us out in the country. I'd also just like to mention that my contact details are at the end of the presentation here for anyone that is interested in getting more information on how your facility or organisation can be involved with the ERIC program. So thank you so much for this opportunity to speak today, Kylie.
No problems. Thanks, Mitch. It sounds like an exciting initiative for next year. So I'd now like to welcome back Charmaine, who will be speaking to us about her aged care service learning placement. So thanks, Charmaine.
Thank you very much, Kylie. Great. So I'll be speaking on OT student placements in aged care. And these placements, Going Rural Health, started developing in 2017. And it's been really exciting to see how the students have taken to learning about aged care, which is such an area of need in rural Victoria. So students have worked in community settings, in transitional care programs, and in aged care facilities and hospitals. I think, and so Going Rural Health have supported these student placements through providing supervision to occupational therapy students on placement, providing mentoring. We support the students with education on human rights and on wellness. We provide interprofessional workshops with physiotherapy students, which has been really exciting to hear the students just learn more about dementia care, for example, and the stages of dementia, and share what each of their profession would bring to support a person living with dementia in each of those stages of dementia. We've provided support with technology through the use of iPads, and we've provided students with financial support. So what have students done out on service learning placements in rural settings? Sorry, I'm just getting a bit of feedback. I don't know if maybe somebody's mic is not muted. Services that students have delivered have included education. They have provided education to fellow students. For example, when medical students were on placement, occupational therapy students were able to help the medical students understand what is the role of the occupational therapist in aged care. They've provided education on best practice pressure care management for nursing staff. And this year, which was very exciting, one of our students from Monash University, Melanie Chan, she developed a PowerPoint, narrated PowerPoint presentation for staff on how to ensure social connectivity for elderly people when faced with restrictions such as COVID. And these are just some of the slides that from Melanie's PowerPoint, where she shares examples of what staff could be engaging with their residents, connecting residents with their family members, with community members. There's an example of some local school children writing letters to elderly people. So Melanie looked throughout Australia and internationally what was happening in aged care to support our elderly residents. And there's just another example. I love the top one on, it's my left, hopefully your left, where they actually connected two aged care facilities in the same town via a Zoom session so that residents could connect with people that they'd maybe lived in that town for many years with. Right, so what other services have students delivered? In the aged care facility in the hostel, they have developed and run reminiscence therapy programs. They've also developed and run social interaction groups for people with impairments in sensory functioning, and they've provided one-on-one dementia care. So there's an example of our students running a reminiscence group at the time of Prince Harry's wedding, and the elderly residents just really loved reminiscing about their weddings and weddings they had attended. And services in transitional care programs have included students having individual caseload, completing assessments of activities of daily living, prescribing and sourcing assistive equipment for community members, completing mental health assessments, including a mental state examination, And then in the community, students have gone out and done home assessments. They've drawn home modifications for patients and liaised with the relevant builders and case managers, as well as liaising with organizations to provide equipment for elderly people. And lastly, they've completed scooter and wheelchair assessments. And so it's very exciting to continue to support these students out on their rural placements with occupational therapy having a lot to share to support the services that are being provided. Thank you very much.
Thanks, Charmaine. I'd now like to introduce Assistant Principal Alicia Jackson and welcome back Rebecca Oates, and they're going to present today on the school-based learning placement at Waranga District Special School. So thank you so much, Beck and Alicia.
Okay. All right. So today we will be presenting on a student-led physiotherapy model that was implemented at the Wangaratta District Specialist School and the adaptations we made in response to COVID-19. I'd like to introduce to you Alicia Jackson, the Assistant Principal at Wangaratta District Specialist School. And my name is Rebecca Oates and I'm from the Going Rural Health team based in Wangaratta. I'll now hand over to Alicia. Thanks, Alicia.
Thanks, Beck. I just wanted to introduce the school and give you a bit of a background. So we're a special school catering for students with intellectual and associated disabilities. Our current enrolment is 156 students. We have over 60 staff, which includes teachers, education support, allied health staff, social workers. Wangaratta services Burnella, Myrtleford, Arvins and King Valleys, Rutherglen, Waganya and the Wangaratta districts. We currently have 19 classrooms with a teacher and an aide in each room and between 5 and 12 students in a class. So one of my roles as the AP is to oversee and lead the allied health team. So we have currently an OT, a speech and an allied health assistant. I wish to continually challenge the tunnel vision and misconceptions that teachers sometimes hold and leadership may hold about the role of a physio student or a physiotherapist that we have at the school. And I want to encourage teachers to embrace the knowledge and expertise of our allied health professionals to create a holistic approach to student learning and wellbeing. So this year, we currently have no physiotherapist and we have not been able to recruit one in the past. So our OT takes on a lot of the load. So therefore, her load is twice the capacity and other components get missed. We run programs such as hydrotherapy, a physical motor program and physical education, as well as our students needing individual physio needs. So we were looking for an answer to that gap.
Thank you.
So Beck and I communicated and we ended up with an 8 5-week placement block. So we had 16 students across the year and this met our service gap of having no physiotherapist at the school. We were hopefully then able to recruit someone who might want to work at the school in 2021 and we created a paediatric placement opportunity for our students.
Thanks, Alicia. So I will now discuss what the student-led physio model actually looked like. So you'll see block 1 was uninterrupted. However, block 2 saw a shift back and forth to an on-site and online placement model due to quarantining and the school shift to remote learning. Data collection was prioritised in this block in preparation for the shift to the online format. So this was quite a time of uncertainty where lots of placements were getting cancelled. So that was a priority for us. So to create placement certainty and avoid disruptions to service delivery, a shift to the online placement model was made in block 3. Privacy and confidentiality measures were reviewed to reflect off-site learning. Other adaptations included the agreement of a telehealth conferencing platform, the dissemination of IT equipment to students such as webcams, the adoption of tele supervision, altered placement objectives to align with scope of practices, and the student-led completion of a tele practice policy for the Wangaratta District Specialist School. Further blocks saw ongoing refinement of policies and procedures, the recommencement of on-site placements, and further shifts between the online and on-site placement models due to intermittent quarantining requirements. Due to border closures and the metro lockdown, Block 6 was cancelled due to the unavailability of physiotherapy students' attendance on site. Despite measures to seek an alternative service tertiary provider, placement objectives and associated deliverables were again reviewed to reflect the allocation of single students in Blocks 7 and 8. As you'll see, that's what Block 8, which I'm pleased to announce finishes next week, and we've remained on site for the whole block.
So part of our learnings and reflections of having the physio students on placement, we were able to foster a relationship of learning between our teaching staff and our physiotherapy students, but also between my institution, the Wangaratta Special School, and Going Rural Health with the help of Rebecca. So our aim was to always limit disruptions, and that was a part of limit disruptions to our teaching cohort, but also to our students and their placements. And one of the amazing things that came out of our placement was the telehealth policy, which is also an easy English policy, and the work that's gone into that is very much appreciated and has opened our parents opportunities to gaining physiotherapy or other types of therapy, not just locally, but across the board. So learnings, there was an additional workload on our staff at times, and there was that constant challenge between preconceived attitudes of students and what their placement might look like, and our aims and objectives for the placement. Thanks, Beck. So telehealth is now offered, which is something that we couldn't have dreamed of at the beginning of the year. We've got an increased EFT for next year, so we've advertised for a 0.6 physiotherapist. Future direction is that we're going to continue. Rebecca and I are besties now, and we're going to continue our relationship, and we're going to have a lot more allied health professional PD for our staff, and foster capacity building in whole class approaches to OT and speech and physiotherapy, and we're going to continue to have external supervision arrangements for many of our students across the board.
Thanks, Alicia. So now I'd like to acknowledge and thank the dedicated team who was involved in the model we presented today. This included the staff, supervisors and students at the Wangaratta District Specialist School, Going Rural Health, Australian Catholic University and Charles Sturt University. We acknowledge that this initiative was supported by the Australian Government through the Rural Health Multidisciplinary Training Program. Thanks for listening to our presentation today. Please see on the screen our email contacts for any further correspondence. And you'll also see here a picture of our first block who transitioned to the online format. And we'll be forever grateful for the positive role model that they took in the placement and for working with us in our journey. Thank you.
Thank you.
Thanks so much, Alicia and Beck. Okay, so I think that is it for our presentations today. So we'd like to now get you to unmute Sorry, I'm just looking at my notes here. And turn your audio back on for our panel members. And also I'd like to introduce Kathy Scott, who's a Director of Nursing and Midwifery Education at GV Health. She's going to join us today just to take part in the panel questions. So if you've got any questions, I'd just like to encourage you just to put them in the Q&A component of your webinar. And I'd also like to welcome back Mitchell Dunn, Alicia, and who else have we got here? So I'd just like to thank you all today for all your presentations, and I'd like to direct the first question that's come through to Beck. So how have peer-assisted learning placements worked in the time of social distancing?
So I guess that has been an advantage of the online formats in that, especially in that first wave of the online placements, they were actually also did their communications between each other via the teleconferencing platform. So like the students we heard from Canberra, one was participating in one geographic and one was participating in the other. However, when students were on site, we're always adhered to the organisational policies that were in line with the current government advice. So I guess, you know, the masks and sanitisers and remaining that physical distance. So yeah, we always followed the policies of the organisation in which the students were based at.
Thanks, Beck. We've just got some online questions, and one directed specifically for the Wangaratta District Special School. So Alicia, if you wouldn't mind answering this one, could you please just elaborate on the supervision structure for the physiotherapy students? For example, who was the key clinical educator for this placement?
Yeah, sure. And Beck, please feel free to chime in if you feel like you need to add to it. We had two supervision physiotherapists. So before COVID, Lindsay was our physio supervisor, and she came onto the site and worked with our physio students. So she is an external physio and was employed through Going Rural Health and the school to be able to provide, I think it's 3 hours a week per student. So she came on site and had meetings and then also watched students directly, working with other students. Lindsay then went on maternity leave. So we ended up employing Steph Kennedy, who is also an external physio. And she was completely virtual. So all of her supervision was on Zoom for our students, and they logged in 3 times a week. They were in contact via email. And so it was 3 hours a week per student that we were able to facilitate. And they were in communication a lot. So anything else, Blake?
Yeah, the placements occurred within a collaborative supervision model. So Alicia was their main contact on site. So obviously, as teachers in allied health, we have lots of shared competency areas. So Alicia, you acted, correct me if I'm wrong, but more that operational support and those shared competency areas. So feedback was that the support Alicia provided was invaluable. Also, the student had the role, receive support and mentoring from my role at the Going Rural Health. So things like accommodation, wellbeing, things like technology, troubleshooting, financial support through our program. So that was my role. But also the students had, their peer as peer support and mentoring for each other. So they got to bounce ideas off each other and learn from others. And obviously the broader school community provided the students support and guidance throughout the placement. So we've had feedback that they felt more supported than on any other placement. So that was really good feedback. They always had lots of support and felt welcomed by the school community.
And they sat within our allied health classroom, so where our OT sat, our our speech therapist sat, and our allied health assistant. So they were always asking questions and listening to conversations and doing that multidisciplinary learning. So
awesome, thank you so much. Mitch, can you please just answer one of our other questions? How can innovative rural placements incorporate the needs of Indigenous students?
Absolutely, thanks, Kylie. I would highly recommend placement coordinators and facilities avail themselves of the Good Placements Guide from CATSANAM. CATSANAM is the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives, but their resource is certainly something that is applicable to any health discipline. They provide some really great concrete strategies for helping facilities, placement coordinators, etc., to develop and implement placements which are culturally safe for Aboriginal and Torres Strait Islander students. And, you know, they provide advice about things like coordinators liaising with facilities to ensure that there is going to be a culturally safe environment for those students when they arrive, offering students the ability to attend an orientation prior if that's something that they are wanting to be a part of. It talks about advice for universities in terms of providing dedicated Aboriginal and Torres Strait Islander liaison staff to assist with those learning experiences. And look, I really think that the main thing is for anyone involved in the placement to be really cognizant of what supports and what services are available when those students go out and participate in those placements. So I think obviously every student is different, but I think there's some broad brush things that facilities, coordinators, universities, etc., can be doing, which are really going to promote, you know, a culturally safe learning experience for health students of Aboriginal and Torres Strait Islander backgrounds.
Awesome, thank you so much, Mitch. Kathy, would you mind telling us how Going Rural Health has impacted students from your organisation, please?
Going Rural Health, yeah, it's been extremely supportive of the students that have attended here, and we've only had positive feedback. And we, as you were aware, we run a survey for all our students that attend GV Health, and all their feedback's quite positive, that accessibility and support network through Going Rural Health. But there's also so many resources available on the website, pretty much financial aid too, with the scholarships for clinical placement. That's been positive, and accommodation, certainly in the rural setting. There's accommodation available in Melbourne Uni. We do have GV Health accommodation, but we certainly have a good network with Melbourne Uni across the road, who facilitates some accommodation through the Going Rural space. Yeah, and as for clinical supervisors, Going Rural Health have assisted us with our clinical supervision framework, providing a toolkit to our educators and to our clinical support staff. And so that's been an advantage for the students as well.
Awesome, thank you so much. Brooke, would you mind answering this question that placements have worked in the traditional model for quite some time, so why should we fix something that isn't broken?
Face-to-face placements are still very important, but I think we can all say at the moment that we are all familiar with online platforms at the moment for meetings, appointments, education, all those sorts of things, and we're all using them, schools, universities, workplaces, and our health services. And it's convenient, easy and safe to say that in the future we'll be using them as well. And in terms of our placements, not only the uni and the student wanted the placements to go ahead, but also our health service as well. And we didn't want that to be cancelled. So we had to really think outside the box and get a little bit creative. And our students were coming from interstate, so it was important that we did that to allow the virtual placement to go ahead. But I think it was a really well supported placement. We had 3 to 4 clinicians and educators that were heavily involved in the placement because it was the first one, and Going Rural Health were really well supportive as well in terms of their webinars, and they were able to connect our students with other students that were doing similar project placements at the time. But saying that it wasn't all smooth sailing, there's certainly a lot of work to do in that area. But I would say it's also opened up many more opportunities as well. In terms of, at the moment, we've got some students doing some clinical face-to-face placements here at Numurkah, and they've been able to connect with some of our other health services within NCN and do some interesting clients and things as well via a virtual platform. So that's been really exciting for us and something we haven't done before. So I think it's certainly something where we'll have to watch this space.
That's awesome. So I guess Alicia and Beck, if you wouldn't mind answering this next question because it flows in quite nicely. How do you think nursing placements would work in a service learning format, do you think?
So Beck and I are in conversation about that currently. We feel, from a school perspective, I think anyone having the opportunity to work with children with disabilities is I think that's such a valuable experience because our children come with many health needs and many factors that get in the way. So they're here for learning, but we have to overcome all those other factors first so that then they can learn to the best of their potential. So we were hoping that nursing students on placement would be able to work alongside our allied health team and break down some of those barriers, which could be continence, it could be swallowing issues, eating, positioning issues. We have many emergency situations at the school, which, we're teachers, we're not qualified. We have our first aid. So just having some nursing students on site to support those situations, to upskill our staff, and so that we can become more comfortable and more confident in those situations. But also for the students to be able to help assist in those emergency situations. We have, sorry, I'm just reading my notes. We have lots of policies and procedures that come through from the Department of Education, which are very mainstream based. So if nursing students have their knowledge, they are able to help us to, fill out those policies and make them more relevant for our setting and make them more usable, and even for our parents to be able to overcome those more mainstream documents. We have our H&S committees. We have health and wellbeing programs, sexuality programs, where the nursing students would be exposed to such a range of different learning experiences than they would necessarily in a hospital or in an aged care facility. So that's where we're at.
Thanks, Alicia. Yeah, I'd concur. So I would just think about thinking about the service learning placements we've presented today, and really encourage people to start where the need is of the service and don't make any assumptions that it can't work or it won't work. Just find out where your service gap is in your organisation, and then start collaborating, whether it's your local placement support person in your organisation, whether it's Going Rural Health, whoever it may be, but then unpack, what are the barriers and how can we overcome them? And as we saw today, it's all a learning experience, and as each placement goes through, you continue to refine.
Awesome, thank you so much. We've got time for just one more question. So Charmaine, would you mind just telling us a little bit about how Going Rural Health provides support to aspiring supervisors and preceptors, please?
Absolutely, Kylie. Yes, so it's really important part of our program that, yes, we're supporting students, but we are as much supporting those who are supervising students. So if you hop onto our website, click on education, you can see a list of our education topics there. So there's a basic supervision, there's intermediate supervision courses, there's how to supervise multiple students. And our educators are very knowledgeable on the topic, and they're there to answer all questions that you have about supervising. And then on a more personal level, our staff are often coming up alongside, especially younger clinicians who are maybe a bit anxious about hosting students or how to face challenges that they experience whilst hosting students. We'll come up alongside you and we'll walk that journey with you when you're hosting your first student.
Great, thank you so much. Well, that's it for today. I'd just like to thank all our panels and all of the presenters today, and I'm hoping that we've been able to give you just a glimpse into the amazing work that Going Rural Health has been doing with the support of our partners. And yeah, don't as Beck said, I just love to just encourage you, don't to be confined by what you think, what we've always done, but just to think outside the box in regards to supporting student placements. So thank you so much. I'd like to just close the webinar and just to mention that it's been recorded and on our websites, and all the information is just on your screen right now. So thank you so much, and yes, please don't hesitate to get in contact with any one of us if you'd like some further clarifications or got some questions that you'd like answered. Thank you so much.